My name is Dr. John Foran. I'm a consultant cardiologist. Been working here at the Mater Private since the beginning of the year, so at the beginning of January I arrived. I've come to work here having previously worked in London in a couple of big cardiac centres, and I'm also now the head of heart and vascular here at Mater Private in Cork. I worked at the Manchester Heart Centre, I worked at St George's Hospital, I've worked at the Royal Brompton Hospital more recently, but I've been attached inevitably to other hospitals, district general hospitals, and also places like the Royal Marsden Hospital. During my training I did do a bit of paediatric cardiology at Great Ormond Street Hospital for Children, and basically I've developed skills in general cardiology but also in interventional cardiology, and the two interventions that I offer would be things related to the plumbing of the heart, the coronary arteries, and conditions related to the electrics of the heart, so pacemakers and ablation techniques to deal with abnormally fast heart rhythm problems. I think a lot of patients think their heart disease is a very complicated problem, and they always fear the worst, as you'd expect if you don't know the ins and outs of what we do. But there are many patients who, when they have plucked up enough courage and had their diagnostic test performed or their procedure completed, realise it wasn't as bad as they thought it was going to be, so they're then quite pleasantly surprised. We have to remember that heart disease has risks associated with it, and we usually wouldn't offer a treatment to a patient unless we knew the risk was far outweighed by the benefit. So even though people sometimes find it frightening to be told they need an angiogram, or they need a balloon stent procedure, or they need a catheter ablation procedure. These are the terms we use and explain when we consent patients. Often once all said and done, they find it quite easy to progress with their care.